Now let us understand the classification of antiemetics. There are many classes of antiemetic derivatives, and their main goal is to reduce the emesis either by triggering the CTZ induced emesis, that means by blocking the CTZ induced emesis, which could be either because of further conditions. So let us understand the first category of drugs, anticholinergic drugs. Majorly in the market, the scopolamine derivatives as well as dicyclamine derivatives are used. These are the first category of drugs which are used in the treatment of emesis by blocking the CTZ receptor activation. Usage of antihistamine drugs, that means these drugs will block H1 receptors. They are also called as antihistamine receptor blockers. These drugs like cyclizine as well as meclizine, voclizine, these drugs, sometimes sinazine derivatives can also be used in combination, which could be used as potential H1 blockers, that is histamine blockers, in the treatment of these type of CTZ activated emesis. Promethazine as well as diphenhydramine, these drugs also can be used as the drugs which could block the emesis, that is CTZ emesis, by blocking the H1 receptors. So along with the anticholinergic drugs, these antihistamines, specifically H1 blockers, are used in combination in certain types of poisonous emesis. So along with this, we have other categories of drugs like these drugs which are acting as 5-HT3 receptor antagonists. They are also called as serotonin antagonists. Drugs like ondansetron derivatives. These drugs are mainly used in the treatment of drug-induced emesis or poisonous drug-induced emesis. Prokinetic agents like domperidone as well as risperidone, these drugs are major antiemetic drugs. Haloperidone, promethazine, and these derivatives can also be used along with fluperidine. They are also used in combination with other drugs so that they will also reduce the emesis, which is because of the CNS activation, specifically CTZ activation. So let us understand about all the other classes also. Usage of certain cannabinoids like dronabilone, glucocorticoids, and usage of diazepam derivatives which will be acting on the benzodiazepine receptors. So these are certain classes of drugs which are used as antiemetics. So mostly we will be using this antihistamine derivatives, anticholinergic drugs, antiserotonin drugs. So we will be using this neuroleptic drugs which will be triggering. Antipsychotic drugs can be used like diazepam derivatives, and these are certain categories of drugs which will be blocking the emesis mainly because of CTZ depression. Now let us understand first about the anticholinergic drugs which are used as antiemetics. When we say anticholinergic drugs, the major drug that is used is scopolamine. Scopolamine, let us understand the mechanism of action. These scopolamine derivatives will try to block the impulses, that is neuronal impulses which are coming from the vestibular center, that which are present in the ear. So when there is a disturbance in the vestibular center, this vestibular apparatus gets deactivated. So as a result, the neuronal conduction which is happening from the vestibular apparatus will be blocked, and this movement towards the CTZ which is present in the medulla center will be blocked. Thereby this type of drug like scopolamine will block further emesis which is happening. So generally scopolamine cannot be used in major combination with others. That means these drugs, these anticholinergic drugs, however, are very specifically used only in certain cases of toxicity. That is, whenever a patient is having acute emesis, we will be using this scopolamine derivatives. Generally, this scopolamine drug also has sedative actions, and this sedative action also may cause an effect on the antiemetic activation. These anticholinergic drugs are mainly used in the treatment of motion sickness. However, and in pregnant women, sometimes this morning sickness can also be observed, which could be treated by using this antihistamine derivatives. Most of the time, these antihistamine derivatives, that is H1 blockers, are used in combination with anticholinergic drugs to treat the neonates who are having the post-operative emesis.